So I want to thank you so much for joining me. I like to follow up with individuals after the debriefing to see how things are going. I mean, I remember that you were talking in the debriefing about how you were really worried about your loss of focus and your difficulty concentrating, second guessing yourself. So that also had me worried a bit about how you're doing.
Yeah, I mean, I feel like I'm definitely not at my best, and every time I try to do something, I'm thinking about this other patient. I'm not thinking about the patient in front of me. And a couple of times this week already, nurses have said, I need you to put this order in, and I was like, wait a minute, what was that medication? I can't even remember because I'm not focused at all, and I feel like what's going to happen is that some of my other patients are going to have something bad happen to them. I've already seen that one tiny thing can make such a big difference with this patient that I just caused an error with, and it was my fault, and I just feel like I'm out of control of myself, like that I'm not paying attention to my patients, and I should be. I'm trying to, but I just can't. I don't know what to do.
Yeah, I'm hearing that it sounds like you're feeling afraid.
Yeah, for sure. I'm afraid. I mean, I'm a little afraid for myself, but I'm really afraid for my other patients. I don't want them to have something go wrong, and I certainly don't want that to reflect on me. I'm sure already my chief thinks that I'm a terrible doctor. He's probably not even going to let me practice much longer. I feel like he's always like watching me or like looking over my shoulder. I don't know what other people think of me. It's terrible. I just do not feel like I'm having a great time at work. Like I just feel out of control.
Is there anything that you could think of that would make it better? Is there anything that's come to your mind that you thought, if I could just have this, maybe I could recover or move forward?
Well, sometimes I think if I just could not be working right now, maybe I'd get back to my regular self. But I don't want to do that because I don't want people to think that I'm weak or that I need to, I need a break and they're going to have to cover for me and make, all these exceptions for me because I made a mistake. That means that they're going to have to, compensate for me. And I don't want them to think I'm a bad doctor, but I do feel like I am right now. And I mean, maybe if there was some way that I could get a little bit of time off, that would be great. But I would feel bad about that too. And I don't even know how to go about doing that. And I don't want to look bad in front of everyone else for doing that.
Right. So sometimes that is needed. That sometimes we do need some time to take to recover, to really be able to be at our optimal functioning for our patients. It's not always needed, but sometimes it is. And if you think about, would you take that time if you had some sort of major physical illness that required your recovery? Yeah, you probably would if you had your own surgery or something that came up. In this way, this is needed as well. And there are ways to do that within the system here, to take that time without maybe everybody knowing why. And it is supported because nobody wants you to be here if you feel like you can't do that both safely for yourself and be safe for your patients in that way. We want you to be at your best. What I'm wondering is, would you really be okay with, maybe talking about some of those options with your chief if I go with you?
Well, I mean, it depends on. I mean, I know you're saying that everyone wants us to be supported and that, this is normal, but I guess I'd want to be a little bit assured that they really felt that way, that they weren't going to say, yeah, okay, take some time, and then turn around and say, yeah, right. Dr. Van Neel is having a really hard time. I don't know if she's going to be able to make it, that's what I'm really worried about.
Yeah, of course. So what I'm thinking is maybe we can talk about all of the different options to you, and we can sort of present a little bit of what's going on and see what options your chief comes up with. You don't necessarily have to say off the bat, I need time. Maybe you will. Maybe you won't feel comfortable saying that, but you can say, I'll help you present where you're at right now, and maybe your chief can come up with some options as well, and we can have the discussion, because what we don't want is for you to leave right now, go back to patient care, feeling like you can't be, you're not focusing, you're not able to pay attention, you're not holding on to the things that you need to do to be able to do that safely and effectively.
Right.
Right?
Yeah.
So, what I'd like to do is make sure you have some of the information about how you can continue to access the peer support, other places that you can go to for support when you're this distressed. Employee assistance program. I don't know if you're particularly faith involved, but we do have chaplaincy here. We do have social work. There's an organization, Medically Induced Trauma Support Services, MITS. We can get you that information. And then there's, if you don't want to use, one of those supports, MITS is an outside organization, but there's also, you can go through insurance. We can get you help getting counseling. But I think the first piece is going today and talking to your chief.
Yeah.
And finding out what the options are so that you can be safe here. Would that be okay?
Yeah, I think it would be helpful if you could come too. That would be really helpful. I think just so that it doesn't seem like I'm crazy and can't do my job. It's just I just need like a little help, really.
Right, absolutely. And so why don't we go do that right now?
Okay.
And figure out with your chief what the best option will be for you.
Okay. That sounds good.